Good morning, students. Today's lecture is on steps in community-based research. These are the learning outcomes. At the end of this session, the student should be able to describe community-based research and its importance, describe various community-based research designs, explain the steps in performing a community survey, explain the steps in performing a community intervention trial. Community-based research begins with a research topic of importance to the community and has the aim of combining knowledge with action to achieve a social change. Begins with a research topic of importance to the community and it aims at achieving a social change. Research question is provided by the community. So research question is based on the community's health problem, social problem or health need of the community. Research is undertaken for the benefit of the community with their participation. That's very important. Community participation is needed in community-based research. Community-based research takes place in community settings. It involves community members in the design and implementation of research projects. Okay, another important aspect of community-based research is that it demonstrates respect for the contributions that are made by the community partners, as well as respect for the principle of doing no harm to the communities involved. Community-based research is a collaborative enterprise between researchers and community members. So it engages university faculty, staff and students with diverse partners and community members. It's a collaborative enterprise, collaboration between researchers and community members. Its goal to achieve social justice through social action and social change. Achieve a social change at the last. Okay. Achieve social justice through social action and social change. In most forms, community-based research is also participative. So it is known as community-based participatory research also. It involves various community partners with their participation. Now we can go through some examples of community-based research. Nutrition students researched the relationship between community gardening and consumption of fruits and vegetables. So that's a community-based research. The association between community gardening and consumption of fruits and vegetables. Another example, engineering students researched, designed and developed an aquaponics system to sustain fish and plants together in a local community garden. Aquaponics, they are using fishing and use that water for planting also, agriculture purpose. Chemistry students have conducted a long-term study on local soil quality. That is also one community-based research. Community-based participatory research. Okay. It's a collaborative approach to research that equitably involves all partners in the research process. Okay. There are so many partners and community members in the community. Collaborative approach equitably involves all partners in the research process. Equitable means equal importance is given to all members in the community. and recognizes the unique strengths that each member brings. Community-based participatory research begins with a research topic of importance to the community, with the aim of combining knowledge and action for social change to improve community health and eliminate health disparities. Improvement of community health and removal of health disparities or health inequalities in the community. Now we will go through various community-based research designs. There are so many research designs. Observational studies, otherwise known as non-experimental studies. Observational means we are observing. Experimental studies means we are doing an experiment. Observational studies or non-experimental studies can be of four types. One is community-based cross-sectional research or community surveys. Second type is observational studies which are longitudinal, otherwise known as follow-up studies. Third type is community-based qualitative research. Qualitative research is also there. Then observational studies which are analytical. Observational, but we are comparing between two groups. That's a analytical type. Experimental studies are community intervention trials. We are doing some intervention or experiment in the community. That is community intervention trials. Observational studies, can be most common observational study is community survey or cross-sectional research. It is conducted to study the prevalence of a health condition. Prevalence means if you are going to a village, you want to study about prevalence of diabetes. How many people are diabetic out of total? That's the prevalence of a health condition. Can be studied using community survey or cross-sectional research. Helps to study various risk factors and outcomes of a disease or health condition. If you are studying prevalence of diabetes, you can study all the risk factors related to diabetes, like obesity, lack of physical activity, abdominal fat distribution, family history. All these risk factors can be studied. Outcomes can be studied. Among diabetic patients, you can look for how many of them have diabetic retinopathy, how many have diabetic nephropathy, how many have diabetic foot ulcer. All these can be studied. Data is collected only once. That is a characteristic feature of cross-sectional research. Data is collected only once. It is cross-sectional observational research. How the data is collected? Data is collected using questionnaires, medical examination, laboratory examination, or a combination of all. So, cross-sectional research or community survey can be conducted to study the prevalence of a health condition, to study various risk factors and outcome of the health condition. Data is collected only once. These are the three components. Longitudinal research. Observational studies can be longitudinal research. Data is collected from the community or village multiple times. It is the opposite of cross-sectional. Cross-sectional only once. Data is collected only once. Longitudinal or follow-up study, data is collected multiple times. It is known as longitudinal or follow-up study. Trend of occurrence of disease or trend of occurrence of risk factor can be studied. Trend of occurrence of disease can be studied. New cases can be studied. So incidence of disease can be studied. Data collected using questionnaire, medical examination, laboratory examination, or a combination of all. So longitudinal research is clear to you. Move to next one, community-based qualitative research. Qualitative research is used to study opinions, views, and perception of community. Okay, opinions, views, and perceptions of the community. So, a qualitative study can be used to study health needs, healthcare needs, social needs of the community also. Okay, how the data is collected? Data is collected using in-depth interview or key informant interview. Okay, we can ask um, open-ended questions related to the research question, research problem. We can ask open-ended questions and collect the response from the participant using in-depth interview. Another method is focus group discussion. What is that? If you are doing focus group discussion on diabetes, then you can have a focus group of diabetic patients. 8 to 10 patients with diabetes will be sitting there, and you can ask some open-ended questions to them. They will answer the questions. Why it is known as focus group? Focus group means the discussion will be focusing on one topic. If complications of diabetes, all the questions will be related to complications of diabetes, and all the responses also will be related to complications of diabetes. Then observations. When you are going to a village, you can observe the behavior of people, how they behave to each other, how they do the healthcare habits, hygienic habits of people. Okay, all this can be observed and can be recorded. Ethnographic studies. If you are going to a village, you can study the culture of the people there, behavior of the people there, and you can record all this. This is known as ethnographic studies. Observational analytical studies. Observational studies can be analytical. You can compare one group of people with other group of people, or one group of villages with other group of villages. This can be of two type of designs, case control design or cohort design. Case control design. Case control design, the name means, case means patients. Control means comparison group. Case control design means one group will be having some disease. One group are patients. Other group are comparison group. They are not patients. They are not having the disease. So one group will be having a health problem or having a disease. Okay, one group of village or community or patients have a health problem. Other group of village, community or people does not have that health problem. Okay, so cases and controls. Then both the groups of villagers or people are observed and compared for the presence of risk factor. So I will give you an example. One group of people are having lung disease. Other group of people are not having lung disease. And we are asking the how many of them with lung disease are smokers? How many of those without lung disease are smokers? Then we are comparing the presence of smoking among lung disease patients with presence of smoking among no lung disease people. This type of study design is known as case control study design. Cohort design. Cohort design have two groups. One group of village or community or people are exposed to a risk factor. Other group are not exposed to a risk factor. I will give you one example. One group of people or one group of villagers are having smoking habit. Other group of village or people are not having exposure to smoking. and we are following both the groups for a period of 1 year. How many of the smokers group develop lung disease? How many of the no smoker group develop lung disease? Then we are comparing it. Both the groups of villagers are observed, followed up and compared for the occurrence of disease, outcome or health problem. Community intervention trials. Okay. Effectiveness of an intervention in the community is studied. Okay. So two group of villagers or two communities. One community is having an intervention or exposed to an intervention. Other community or other group of village are not getting that intervention. Then we are comparing the health outcome in intervention group with health outcome in the control group. Intervention can be a treatment, can be vaccination, any health promotion, health education activity, behavioral modification, nutritional intervention, or lifestyle modification. Okay, intervention can be any of these. By comparing one community which is exposed to an intervention with another community which is not exposed to that intervention. And we are checking if intervention is having a better effect or not compared to no intervention. Steps in conducting a community survey. Okay, when you are conducting a community survey, first step is to identify a health problem. Okay, so if you are going to a village, you have to identify what are the main health problems of that village. Okay, identify the okay. We are identifying that diabetes is a problem. So health problem is diabetes. So you have to frame a research question. What will be the research question? Association between diet with diabetes. Okay, association between unhealthy diet with diabetes. That's a research question. Okay, how we will frame the question? Is there any association between unhealthy diet with diabetes? Okay, then you have to do review of literature and identify the knowledge gap. Okay, review of literature, how you will do? You have to collect all the previous research on the risk factors of diabetes, what are leading to diabetes in Malaysian villages, like that. So you have to do a review of literature and identify the knowledge gap. Then refine the objectives. Now you have to decide what you are going to measure. Okay, so the what you are going to measure you have to write down. That is the objective or aim of the research. Okay, it should be smart, should be specific, measurable, achievable, result oriented, and time bound. Okay, smart objective means it should be specific, measurable, achievable, result oriented, and time bound. Okay, in case of diabetes and relationship of diet with diabetes. Okay, then the objectives can be to study the prevalence of diabetes, then to study the various diet behavior, dietary pattern or dietary habits of the villagers. Then you can find out the association between dietary habit with diabetes. So three objectives are there, right? There can be multiple objectives. Choose the methodology of research. What methodology is suiting to it? So if you are studying the dietary habits and its relation to diabetes, you can choose a different type of study design. Qualitative. Qualitative means in-depth interview, focus group discussion, observation. If you want to study the opinion of diabetic patients on the effect of diet, or opinion and views of diabetic patients on risk factors of diabetes, then you can think about qualitative research. So you can conduct a in-depth interview with patients, focus group discussion, and observation of their dietary pattern, like that. Quantitative, using questionnaire. If you want to fill the questionnaire related to dietary practices, lifestyle practices, then you can follow quantitative research also. Cross-sectional research. If you are collecting data only once related to diabetes, related to dietary habits, you are collecting data only once, then you can think about cross-sectional research. Case control design. How it will be? You will have two group of patients. One group will be diabetic patients, one group will be non-diabetic people. And we can check diabetic patients what is a dietary pattern, dietary habits. Non-diabetic people, what is a dietary habit. That type of study design, two groups, diabetic patient and a non-diabetic individuals. That will be case control study design. Understood? Then you can think about cohort design. You can take one group of people with a unhealthy diet pattern, one group of individual with a healthy lifestyle, a healthy diet pattern. So you follow them up for a period of 10 years. Unhealthy diet, how many of them develop diabetes? Healthy diet, how many of them develop diabetes? That type of design is cohort design. Select study participants. Okay, you have to select, okay, those above 40 years of age, because diabetes is more common above, type 2 diabetes is more common above 40 years of age. So you can select this study participant. Inclusion criteria, which age group you are including, which age group you are excluding. Some person is not willing to participate, he is excluded. Some person is willing to participate, can be included, like that. Define the study variables. You have to define what is diabetes, how you will diagnose diabetes, how you will categorize the diabetes. Okay, then what will be the unhealthy diet, what will be the healthy diet. You have to define the study variables. Then sample size calculation. You have to calculate how many people are needed to be included in the research. So sample size calculation based on the formula. You have to calculate the sample size, collect the values from previous research and apply in the formula and calculate sample size. Okay. Next is develop tools for data collection. Data collection, if you are making questionnaire, you have to prepare questionnaire, right? That's the develop tools. If you are measuring anthropometric measurements like height, weight, waist circumference, hip circumference, all these things, then you have to develop tools for that data collection. Questionnaire development, you have to develop questionnaire. Okay, sometimes you can get validated questionnaire from previous research, you can adopt that. But you give the reference, adopted from so and so study, or adopted from this website, like that you have to mention. If you are developing a questionnaire, you have to validate the questionnaire. Validation means make sure that your questionnaire is really measuring what it is supposed to measure. Okay, there are three types of validity: face validity, content validity, and a criterion validity. Face validity means distribute among peers or co-researchers for any gross mistakes. You just distribute your questionnaire. After preparing the questionnaire, you distribute among other students to look for gross mistake. That is known as face validity. Content validity means what? You have to distribute among subject expert. If you are asking some questions related to diabetes, you have to distribute among physician or diabetes specialist, diabetologist. Okay, that is content validity. Criterion validity means you have to get similar questionnaire from other studies and make sure that your questions are matching with questions from other studies. That's criterion validity. How it matches with other validated questionnaires which are published in previous research. Okay. After the validity, you have to look for the reliability of questionnaire. Reliability is otherwise known as repeatability of the questionnaire. If you use the same questionnaire again and again, will you get the same result or same answer? Okay. There are different type of reliability. One is known as test retest reliability. You distribute the questionnaire today and after 3 days you distribute the same questionnaire to the same person. So will you get the same answer or not? That is a test retest reliability. Getting similar answer when asked at different times, different situation by different people. Okay, that's very interesting, right? Test retest reliability. Second type of reliability is alternate form reliability. What is that? You ask the same question in different way, or you reframe the question and ask, okay, will you get the same answer? I will ask you two questions. First is, at what time do you wake up on weekdays? Your answer is 6 a.m. Second, I am asking in a different way. Okay, how many hours before the start of class you wake up? Okay, your answer will be 2 hours before the start of class I wake up. Okay, so both are giving same answer but different way. Okay, framed in different way. Questions are framed in different way but give similar answer. That is known as alternate form reliability. Next component is also very interesting. Internal consistency reliability. What is that? You are asking three questions related to depression. Three components of depression. One is sleep, one is appetite, third one is socialization with friends. So first question is your sleep reduced recently? So your answer is yes. Second question, is your appetite reduced recently? So that also answer is yes. Third one, is your socialization with your friends reduced recently? So that also yes. So three components are measuring the same variable, that is depression. So three components, like three items are there. One related to sleep, another related to appetite, third one related to socialization with the friends. So all the three measure the same variable of depression. Okay, we have to check if all the three components have internal consistency. There is consistency between answers given for different questions which are supposed to measure same outcome. Different questions means three different questions for depression which measure the same outcome, depression. Is there any internal consistency? Tested using Cronbach alpha test. Okay, Cronbach alpha test, if the value is more than 0.7 means there is internal consistency reliability in the questionnaire. That questionnaire is having internal consistency reliability. So these are the three things we have to keep in mind when you are testing reliability. Test, retest reliability, alternate form reliability, internal consistency reliability, which is tested by Cronbach alpha test. After that, these all components of methodology finish. Okay, then questionnaire development is done, all the methodology is written. Then you have to prepare the proposal. Okay, proposal is very important. It gives a blueprint how you are going to do the research. Okay, it should have introduction or objectives, then methodology, should have study design, study setting, where the study is done, study period, which is a period of study, study participants, inclusion criteria, exclusion criteria, sampling method. Okay, is it a random sampling method or convenient sampling method or non-random sampling method? Sample size calculation using the formula. You have to calculate the minimum sample size. Study variables. You have to write the study variables, define the study variables. Then about the questionnaire, how you develop the questionnaire, how you validate it, how the reliability is done. Method of data collection, how you are going to uh, collect the data, how you are going to analyze the data. All this you have to write in proposal. After the proposal writing, you have to get ethical clearance. Okay, make sure that your study is ethical. So these are the components which are needed. First, your study should have informed consent. Collect informed consent from participants. Informed consent means before participation in the research, they should be informed about the research. What is about the details of the research should be informed to the participant, and then consent should be obtained from the participant. Then second component of ethical clearance is confidentiality of participants must be maintained. Confidentiality must be maintained. Third one, ethical clearance from institutional ethical committee. If you are doing a research, you have to collect ethical clearance from Quest Ethical Clearance Committee. Then if you are collecting data from hospitals or from patients, you have to get NMRR clearance. That is National Medical Research Registry. National Medical Research Registry. Okay. After that, after getting ethical clearance, you have to start data collection. Okay. After data collection, you have to key in the data, data entry and analysis of data. After that, what is the next step? Discuss and compare results with a similar research. Some other research may have got published recently. So you compare your result with other research, similar research. Then you write the report. That is a research report writing. You have to write the report. The last step is presentation and publication of finding. Presentation of your finding in different conferences, seminars, and other websites. You can present your finding, and you can publish your finding in journals or scientific journals. Okay. Now we will go to the last part, go through the last part of the session, steps of community intervention trials. Okay. Community intervention trials have four major steps. First is selection and randomization of experimental and control villages. So there will be experimental villages or experimental group should be there, and a control village or control group should be there. Experimental group will get a intervention. Okay. Control will not get that intervention. Okay. Then baseline data collection from both groups of villages. Baseline data should be collected. I will give an example, then you will understand better. Intervention to experimental or intervention village. Okay. Then after that, last step is data collection, comparison and interpretation of findings from both the villages. Okay. So I will give an example. In one district, dengue fever is very common. Okay. So we are selecting 5 villages randomly from the district as intervention villages, and 5 villages randomly we are selecting as control villages. So we are giving an intervention. So what intervention we are going to give, we are giving intensified fogging activities in experimental village and no intensified fogging activity in control village. So first step is selection and randomization of study and control groups. So intervention villages and comparison villages are selected randomly from the list of villages in the district. Maybe 50 villages are there. So we are selecting 5 villages as intervention village, 5 villages as control village. We are selecting randomly. That's why random. Okay. Then we are looking for baseline data collection. We are looking for the dengue fever cases of intervention villages and dengue fever cases in control villages before the start of intervention. That is a baseline data collection. Baseline data related to outcome from both study or intervention village and control or comparison village are collected. So now we are giving intervention. Intervention A is given to study village or intervention village. So these 5 villages which are intervention village, we are giving intensified fogging activity. Okay, every week we are giving 3 times fogging for a period of 6 months. Okay, every week 3 times fogging. Another villages, no intensified fogging activity, just follow the government guideline. Okay, intervention A is given to study or intervention village. Intervention B or absence of intervention A, no fogging, is given to comparison or control villages. Okay, after 6 months, we are collecting data collection, comparison and interpretation. Okay, we are data related to health outcome, maybe the number of dengue cases from intervention village, number of dengue cases from control village. We are collecting data related to health outcome are collected from study and comparison village. Health outcome from both study villages and comparison villages are compared. We are checking intervention village, how many cases of dengue per every month. Okay, control village, how many cases of dengue are reported every month. Okay, then we are comparing. Then we are studying the effectiveness of health intervention is interpreted. Okay, you please keep in mind, intervention village, we are seeing that number of dengue cases are lower compared to control villages. So we are interpreting that because of the intervention, because of the intensified fogging activity, the number of dengue cases are lower in intervention village compared to control village. So that's a basic concept of intervention trial, community intervention trial. Hope you understood. Thank you.